Bankart surgery is trying to repair the natural restraints of the shoulder after it has traumatically dislocated. Typically that happens in an athlete. Sometimes it's a contact athlete after, say, a football player gets tackled. Sometimes it's after a wrestling injury. Sometimes it can even be in a non-athlete that just falls and lands a certain way on the shoulder, and the shoulder subluxates or dislocates out of joint. Traditionally, we have tried to fix these with open procedures, and with an open procedure, you actually have to go through the muscle and the capsule in order to get to the structures that are damaged. Today, what we try to do is recreate the anatomy by using small, tiny incisions and inserting a camera inside to try to fix the tissue that's been torn. Probably the easiest way to think about that is if you had a golf ball and you put it on a tee. And if you look at a tee very closely, you'll see that the edges are actually rounded up, and the golf ball sits right on top of the tee. Well, if you took that tee and you chipped off just a little bit of the edge on one side, that golf ball would roll off. And that's what we're trying to repair, is the labrum. That's the little edge, the little piece that gets chipped off. Sometimes it can be bony, in which case you may hear the phrase bony Bankart. Other times it's just soft tissue, in which it's labrum. And what we're trying to do is re-anchor the labrum and tighten down the capsule a little bit at the same time. Typically it's done as an outpatient procedure. You come in the same day of surgery, you have the procedure, and then you go home the same day. After surgery, you're usually in a sling, and a lot of times we'll even use cold therapy to help reduce the swelling and help with pain. By doing it arthroscopically, the recovery time seems to be much easier on the patient.